I have three wonderful boys and a wonderful husband, and I'm not going to see them again.
That's Michelle Dreyer, a sleep tech at Unity Point Health, and those were the thoughts rolling through her head as she was getting rolled into the emergency room last May.
It was horrifying. I mean, my husband was the one that brought me to ER, and then, he couldn't come in with me.
Michelle was on a ventilator for 5 days, having to rely on her doctor to communicate with her family. She says she lost her hair from COVID and to this day still deals with brain fog. But the worst part, she says,
Not knowing if you were ever going to see your family again.
And she's not alone. Yancy Reynolds, an active 49-year-old, contracted the virus just before Christmas. Yancy tells me she's starting to get back to normal, but there's still a lot of challenges she faces on a daily basis.
Memory loss, stamina, fatigue, just not really able to be myself yet.
Yancy was in the hospital for a few days and then put on oxygen afterwards. Her message for Illinoisans:
still take it serious, still be cautious.
And while just months ago we thought our hospitals would be overrun with COVID patients,
I was afraid I was going to say, we can't care for that patient.
Dr. Samir Sater, the chief medical officer at Unity Point Health, says there is hope.
There is a feeling of accomplishment right now regarding everything we had to do to get the hospitals ready to care for the number of patients that we had to care for.
Dr. Sater actually got COVID-19 from working at the hospital. He said it took 2 months for him to get back to normal.
Truly being isolated because you're sick and you don't want to infect your wife or your kids was a little different.
Dr. Sater says one thing the pandemic has taught him is America needs more nurses. He credits the progress the United States has seen to the success of the vaccine and the fearless dedication of medical professionals.
There was a true emergency, a true pandemic, which we hopefully won't see again, but people stepped up.
Dreyer's head doctor on the floor she works on ended up being her primary doctor when she was on a ventilator. She agrees with Dr. Sater.
What do you think kind of got you through this entire thing?
The love and support from my family, the prayers, and of course just the wonderful care from the doctors and nurses.